Since 1990, Montgomery County Coalition for the Homeless has ended homelessness for thousands of our most vulnerable neighbors, including Laura, Samaria, and Mitchell. Their traumatic experiences of homelessness have one far too common and devastating theme: living without a home and managing chronic illnesses and diseases. Laura experienced homelessness while working full-time at a coffee shop, but the long hours on her feet were taking a physical toll on her. She found a less physically demanding job as a driver for a ride-sharing service, which was easier on her body, but unfortunately left her without health insurance. Her doctors warned her that she was at high risk for diabetes and a stroke.
I was looking at, with the diabetes, the stroke factor, because my grandmother died from having a stroke.
But she was living in her car and lacked the resources to address these health concerns.
I was a mess. I had bronchitis every winter. I could not get, it took me 6 months to get rid of that cough.
Samaria experienced homelessness with her 2 children after escaping domestic violence.
I had heart surgery, so I had a mitral valve replacement, 2012. And now I'm going through, I have like ovarian cysts, and I had surgery twice, and this is probably gonna be the 3rd surgery. When you have kids, it's so much harder.
Mitchell was born with a rare genetic chromosomal disorder. Following the death of his mother, who was his only support system, he experienced homelessness for several years and was living in a storage unit when he knew something was seriously wrong with him.
It was cancerous. While I was living in my unit, I had to have surgery in Baltimore. The recuperation was the hard part because it was during the wintertime, snow, ice, and dealing with my cancer treatment, radiation, it was tough.
When MCCH provides someone a home of their own, they can finally rest, heal, and begin to move forward with their lives. When the exhaustion, nausea, and physical pain overcame him, Mitchell knew he needed a real home. After finally seeking help from emergency shelters, Mitchell received the best news. He was moving into a home of his own, with the help of MCCH.
I was so excited because, one, they provided me with a new queen-size bed with mattress and box spring. Keep in mind that I was dead tired, worn out, collapsed at any moment, I'm very grateful. I really am very grateful. I'm very humble. And I'm just so, I guess, for lack of a better word, I'm so blessed.
Samaria moved into MCCH's Seneca Heights Apartments community, where she has access to transportation to all of her medical appointments, as well as engaging activities and on-site tutoring for her children.
I feel better now. I feel more, I feel safe. I feel like release. I don't know, something just, because before I couldn't even sleep or nothing. Like now I can sleep. They help a lot with everything. I like everything about here.
When it got too cold to live in her car, Laura went to a local shelter where she connected to MCCH, which provided her with a permanent home.
They helped me get health insurance through Maryland state program, and then I started going to see the doctors. This past winter, 18 into 19, was the first year I've never had bronchitis. This is wonderful, wonderful improvement all the way around. That and my health. That has been a major, major improvement as well. My doctor said this is probably the healthiest I've been in quite a while.
Mitchell, Samaria, and Laura are thankful for the support of MCCH and our generous community members who have enabled them to regain their health by providing them with a safe, stable, and affordable place to call home.